The first landmark of the upper limb we can see highlighted here is the rounded shape at the top of the arm caused by the deltoid muscle. This powerful and prominent muscle actually gets its name from its shape, which sort of resembles the Greek letter delta, as you can see here. As we can see, this muscle forms the rounded contour of the shoulder, which is why it is commonly known as the shoulder muscle. The shape of the deltoid muscle can also be seen clearly from a posterior view, and if we take a look at the muscle itself, we can see how this muscle wraps around and attaches to the scapula to help form the shapes we see on the tops of the shoulders. If we remain here looking at the posterior aspect of the arm, the outline of the triceps brachii can also be easily distinguished. If an individual is relatively lean or very muscular, you may be able to see this upside-down U shape when the muscle becomes flexed. This impression is created by the shape of the tendinous fibers underneath, as we can see in this image just here. Looking now at the posterior aspect of the cubital fossa, a bony eminence can be seen, which is the olecranon of the ulna. This eminence is more commonly known as the elbow. The olecranon serves as the attachment point for the triceps brachii muscles that straighten the arm, a sort of lever if you like. It also prevents the elbow from overextending. The prominence of this landmark, while having its uses, unfortunately carries the trade-off of also making it pretty susceptible to trauma. Ouch! Turning around to look at the other side of the elbows, close to the inferior insertion of the biceps brachii muscle, we can see a triangular area known as the cubital fossa. Also known as the elbow pit or the antebrachial fossa, this area is clinically important as it is where a stethoscope is placed over the brachial artery during blood pressure measurements. In addition, the superficial area just above the cubital fossa is often used for venous access or venipuncture, and the brachial pulse can also be palpated at this fossa. Just superior to the cubital fossa, the form of the underlying biceps brachii muscle is easily visualized. This two-headed muscle, like the triceps brachii, is also quite prominent when in action, for example when you flex your arm or make a really tight fist. Nearby, we can also see the region known as the axilla, more commonly known as the armpit or the underarm. This region is located directly under the glenohumeral joint at the junction of the upper limb and the thorax. This area of the body is typically characterized by hair growth and the formation of body odor due to the presence of a significant number of apocrine sweat glands. The muscles that form the shape of the forearm that we see here are known as the antebrachial muscles. There are quite a few muscles in the forearm, but we don't need to list them all individually to understand their effect on the surface anatomy. The lateral group forms this thickening we see here on the radial aspect of the forearm, while the medial group also form a smaller but still palpable shape just here.
If you found this quick anatomy or physiology video helpful, you'll enjoy our video tutorials even more. Click on the button and you'll see what I mean. We have hundreds of videos available to our premium members, not to mention all the fun quizzes, complete articles, and atlas sections to solidify your knowledge. Click on the button in the middle to watch the full-length video and master anatomy and physiology.